Right. Hello, everybody. Welcome to my channel. My name is Dr. Mickey, Shanya Hospital, Central South University, Orthopedic Surgery Department, China. Today, I have a guest with me, and we're going to talk about acute abdomen. That is a medical condition that most patients come to the clinic with as a chief complaint. And today I have with me a special guest, and I would allow him to introduce himself. Welcome, Doc. Can you just give us a brief introduction about yourself?
Hello, everyone. I'm Abu S. Buhmie. I'm a final year student of the Hunan University of Chinese Medicine.
All right, Doc. Thank you for your time and thanks for joining us on our channel today. Right.
Okay, you're welcome.
All right. So today as we said, we're going to talk about acute abdomen, or somebody would say abdominal pain, or let me say a layperson would say stomach pain, because those who are not in the medical field will probably say I have stomach pain, and that is most common chief complaint that a patient comes with in the clinic. So, Doc, what is
So,
your take? What do you think in a definition, a medical definition or terminology? What do you think an abdominal pain or acute abdomen is? Can you just give us a brief, overview of abdominal pain or acute abdomen?
basically, when we talk about abdominal pain or acute abdomen, that is it, like a sudden, um, a sudden pain, like a sudden stomach pain, and very severe. So,
Okay,
um, but most of the time, like outside of the medical setting, we just call it like stomach pain. Yeah.
okay,
But yeah, acute abdomen is like a severe pain, a severe pain that just um come out suddenly. Yeah.
I see. I see. So I like your definition, Doc. The word sudden, yeah, that is the most important part because
Yeah,
that,
so sudden and it's not like every other pain associated with the abdomen.
okay,
Yeah, we
yes.
have yeah, it's it's sudden and very severe.
Oh, that's good. That's good.
Yeah.
I like your definition because as we know, so the acute setting, when you say even in the medical term or in the medical word, we say acute and chronic. The difference is
Mm-hmm.
that we look at the time difference or the duration of the occurrence of maybe a disease. So we say acute something and chronic something, right? So we are actually
Sure,
talking
sure.
about the duration. So in this setting, as we said, acute abdomen, then as you said,
Mm-hmm.
meaning a sudden onset of
It's
abdominal
sudden
pain,
onset of
of
sudden
severe.
onset of abdominal pain.
Yeah,
Yeah.
good. So the keywords are sudden onset and severe. These two,
Sudden and severe.
very
Yeah.
important. Thank you very much for your point, Doc. I do. I think the people out there can also now understand what is meant by acute abdomen. So whenever they are
Yeah,
being
because
asked
mm-hmm,
in the
mm-hmm,
maybe Viva or whatever in their exams about what is acute abdomen, I think they can now
mm-hmm.
define it
They
as
can be
a
able to.
sudden onset
Yeah.
of severe abdominal pain. Right. Anything to add?
Yeah, even there are people who are not within the medical setting, they should be able to understand what an acute abdomen is.
Oh,
Because
okay.
a patient will not come to the hospital and tell you that, oh, I have an acute abdomen. Yeah.
Mm.
So most of the time he or she may tell you that, oh, I have um I have a pain. Let's say I have a stomach pain.
Oh,
So
okay.
on the basis, that is the reason why to diagnose acute abdomen, we need to do a proper history. Like we need to take a proper history, do a proper medical, let's say physical examination. We have to do all of these things because the patient, through the process of physical examination, let's say the history taking, the patient is going to tell you how the pain started and what is the characteristics of the pain and all of that. And on the basis of that, you can be able to know whether it is an acute abdomen, a full acute abdomen or not.
Wow, wow, that's good. That's
Yeah.
good. All right,
Mm-hmm.
Doc. Thank you very much. So we know the definition now. And somebody will
Mm-hmm.
ask that in case now I'm talking about my abdomen or maybe my abdominal region, I might not know whether it is part of my chest cavity or not. So if I may ask, in a medical world, in medical field, how many quadrants that we have if we want to divide the abdomen into quadrants? How many quadrants do we have?
Uh, so in order to properly diagnose acute abdomen, we will have to know the quadrants of because the abdomen as a whole, when we say the abdomen,
Okay.
that is medical term, yeah.
Okay.
But
Okay.
we are basically talking about the stomach, that is this region,
Hmm.
yeah.
Okay.
So we can divide the abdomen into four distinct quadrants.
Okay.
Four
Okay.
quadrant, yeah. So um we have the right upper quadrant, we got the
Okay.
right lower quadrant, the
Hmm.
left upper quadrant, and the left lower quadrant.
Oh wow.
So based on the location of the pin, if you have a pin within a specific quadrant,
Okay.
the underlying pathology may be different from a
Okay.
pin within. Let's take for an example, if you have a pin within the right lower quadrant,
Okay.
let's say you have a pin in the right lower quadrant, the underlying disease, the disease that causing that pain will be different from the disease that may be causing a pain in the right, let me say in the left lower quadrant.
Okay. I
Are you get
see.
are you getting my point? So
I'm
it is
getting.
very important. It's very important for us to understand the various quadrants or the abdomen. So that is the reason why during the course of history taking, we have to ask the patient about like initially, where are you feeling the pain? What is the site of the pain?
That's right.
So that we can have a broad idea of what exactly is going on.
Oh, that's good. So, from your answer, actually, you have four quadrants, right? So,
Sure.
if I may repeat, you said the right upper quadrant, the right
Mm-hmm.
lower quadrant, the left upper
Mm-hmm.
quadrant, and then the left
Mm-hmm.
lower quadrant, right?
Right.
Okay, right. So I think that people out there can also take note of that. But I think in medical world or maybe medical field, we also divide the abdomen into, I mean, regions because I think that quadrant is actually four portion and division of the portions or subdivision of the quadrant is what we call the regions of the abdomen. So do you have any idea about that too?
Mm-hmm.
How many regions and something like that do we have?
Okay, so as we said initially, the stomach is divided into four different quadrants. We are already spoken about that. So now within the quadrant, we can divide the abdomen into nine different regions.
Okay.
Nine different regions. So we we have the epigastric region. We got
Okay.
the epigastric regions. We
Okay.
have the right hypochondriums,
Okay.
the left hypochondriums. We
Okay.
have the left lumbar regions, the right lumbar regions. We have the umbilical region. That is the regions around your navel, the umbilical area. And then we have the suprapubic regions, or we say the hypochondrial regions. And then we have the right iliac fossa and the left iliac fossa. I would say left and right groin.
Okay. Okay.
So these are the nine different regions out of the four quadrants.
Oh, I see. So you have nine regions, right?
Yes.
Okay. And I think I have to your submission and to add to what you just said, I have a PPT that maybe I would like to show to the viewers. Maybe they also
Okay.
find it interesting about these quadrants because maybe somebody out there might probably not don't know what we're talking about. So I think we can show it to them. All right. So a few minutes. All right. Okay, Doc. I think you need to, if you can share it with them, it will be fine. Do you have it?
You mean to share my screen?
Yeah. Can you share with them?
Do you mean to? Let me see what I can do. That. Let me check. But
Yeah.
I can demonstrate that so that you can just see. Because I have not seen an
Yeah.
option here. Okay, okay.
Like,
There is an
yeah, there's a share
option to
screen.
share.
Yeah. So
Yeah.
if you can open it, and if you have something to show us, like a PPT from
Mm-hmm.
the various quadrants and then abdomen, it would be nice. Yeah. Because
Yeah. There
I
is.
think, yeah. So you can open, I think, and share with us.